UnitedHealth asked regulators to exclude shareholder proposals on prior authorizations denied claims. Specifically, the proposal is seeking an analysis of how prior authorization requirements or coverage denials may result in delays or abandonment of medical treatment. UnitedHealthcare wonders why people hate them. Hey, it's Jordan. I am in Flint, Michigan, East Palestine, Ohio, Tumwa, Iowa. Please support the only independent outlet on the ground covering what the corporate media covers up. Hey, it's Jordan with Status Coup. Luigi Mangione, the alleged shooter of UnitedHealthcare CEO Brian Thompson, has now formally accepted over $300,000 in funds that were donated to him by supporters around the country to go towards his criminal defense, a criminal defense that now in less than a week might have an update in the case, which I'll tell you about in a minute. First, let me show you, this is from his Give, Send, Go page. He has raised from folks around the country, perhaps the world, $326,000, over $326,000, with a goal of $500,000. And the organizers of this fundraiser gave an update yesterday. Dear supporters of the Luigi Mangione Legal Fund, we are excited to announce that we have established contact with Karen Friedman Agnifilo and the rest of Luigi's legal team. Friedman Agnifilo is his chief attorney, who will be accepting your donations. In response to hearing about your 10,000 plus individual donations, averaging under $30, Karen stated that Luigi, quote, very much appreciates the outpouring of support. We feel honored to provide supporters with a reliable way to continue contributing to his legal fees through any future donations. Yesterday marked the 2-month anniversary since Luigi Mangione's arrest. Americans watched the media scramble to demonize him as social media comments overflowed with support. The average American understands who the real culprits are, despite the ghoulish display of power during his perp walk or the out-of-touch coverage most media pundits offer. Nothing can shake their resolve. On the contrary, these attempts to diminish his support have only backfired. Even the Newsweek article, this was last week, that attempted to characterize this fund as stagnant was met with a surge of new donations. Since then, 6 days ago, the fund has skyrocketed another $64,000 with no signs of slowing down. Prosecutors have responded to this support by levying unprecedented terrorism charges against Luigi, which would make him eligible for the death penalty. This is fundamentally unacceptable. We are thrilled that the money raised by this campaign will go towards building the strongest possible defense against these insulting charges. So again, this is Give, Send, Go, and he's raised $326,555 with a goal of $500,000. And that's going to come in handy because now in less than a week, we might see a formal indictment from the federal government. So obviously there's a lot been going on in the country under Trump's flood the zone strategy. So you might have forgotten this, but the case had been delayed in January. So the man accused of gunning down UnitedHealthcare CEO outside a New York City hotel is unlikely to appear in Manhattan federal court again before mid-February, after prosecutors and lawyers on Monday requested more time to prepare for the case. This was in January. The lawyers agreed in a letter to the court that the deadline to bring an indictment against Luigi Mangione can be extended from January 18th to February 17th. So February 17th would be this coming Monday, so less than a week from this recording. Mangione right now is charged in a criminal complaint, which is a document that is lodged against individuals prior to the return of an indictment. So, I mean, it's almost definite that we're going to see a formal indictment, we think, by February 17th, which would be Monday, and then the case proceed. As I said earlier, weeks earlier, I found it interesting that the prosecutors agreed to this delay. If they have him, dead to rights, as the media has routinely reported, they say that they have him on camera, they have fingerprints, they have all these things. Why would you give the defense more time to prepare, particularly to prepare against the unprecedented terrorism charges? So I found it questionable that the prosecutors agreed to this delay. But again, in less than a week, we will most likely be seeing a formal indictment against Mangione. Now, as Mangione's fundraising continues to grow, again, it's grown over $64,000 in a week to the Give, Send, Go. United Healthcare is spending its time basically begging the federal government to protect it from its own shareholders' rather weak request for United to look into, make a report on its denial process. You really can't make this stuff up. It's truly unbelievable. United Healthcare wonders why people hate them enough to the point that someone Luigi allegedly killed its CEO. United Health asked regulators to exclude shareholder proposals on prior authorizations denied claims. United Health has asked the SEC, that would be the Securities and Exchange Commission, to exclude 2 shareholder proposals from its 2025 annual meeting proxy materials that raise concerns about the company's handling of prior authorization requirements and denied claims. The first proposal from the Duracher Fund was submitted in December to the SEC and is calling on United Health to prepare a report that assesses the public health and economic risks associated with the company's practices that may limit or delay access to healthcare services. Specifically, the proposal is seeking an analysis of how prior authorization requirements or coverage denials may result in delays or abandonment of medical treatment and potentially lead to adverse health outcomes for members. So, bottom line, I mean, this is the equivalent of like politicians saying, yeah, we should really set up a commission to study reparations. You know, the shareholders, I think this is a rather weak, substanceless request for them to create a report on their denial process and prior authorization use. I think the shareholders kind of know from reports out there that they're committing fraud and preying on innocent, sick Americans. You don't need a report to tell you that. But anyway, the shareholders wanted to act like they're doing something. For context, if you don't know, the Securities and Exchange Commission, which was asleep at the switch before the financial crash of 2006, 2007, 2008, crash was in 2008, but the warning signs were there starting in 2006. Securities and Exchange Commission actually regulates shareholder resolutions that are proposed for public consumption. Shareholder resolutions are usually given at an annual company meeting or something. So the SEC regulates what can go forward to the public and what cannot. For example, the SEC has ruled in favor of certain companies, shareholders, resolutions for climate change, say at fossil fuel companies. So rather than United Healthcare just accepting and allowing those shareholder resolutions to go forward at their meetings, shareholders' resolution to create a report on your predatory, murderous practices, they want to block it, and they want the Securities and Exchange Commission to block it, essentially for public relations and legal maneuvering. So they don't want to be the bad guy. They want the federal government to bail them out from any public scrutiny, particularly from their shareholders, against their predatory practices. There's 2 separate letters that United Healthcare has sent to the Securities and Exchange Commission. I'm not going to read you the whole thing, but I'll read you, the important parts. This one was sent on January 21st from United Healthcare, and they tell the SEC the proposal from shareholders set forth the following resolution to be voted on by shareholders at the 2025 annual meeting. United Health Group should incorporate a third-party auditing process for auditing previous customer denial claims, particularly where a death was involved, to determine if denial letters included factually incorrect and insensitive information. If it is determined that the claim should have not been denied, our company should write apology letters to the family members and those personally affected by the coverage denial. These letters should be hand-signed by at least one executive board member and at least one member of the board of directors of United Health Group. The basis that United Health wants the SEC to block this from moving forward blocked the shareholders' resolution to this auditing. As discussed more fully below, the company believes that it may omit the proposal from its 2025 proxy material because the proponents submitted the proposal after the applicable deadline. You know, UnitedHealth is just a stickler for the rules and they missed the deadline to submit it. First of all, with all due respect to United Healthcare shareholders, your proposal is for an auditing process. And if you find that denials were inappropriate, which, hint, hint, you don't need an audit for that, you're going to find it. There's been oodles of reporting that United is intentionally and meticulously denying claims to make more profit. Your answer is to send the families of denied patients an apology letter stamped by the CEO. Hey, we're sorry that our denial of claim, we sincerely apologize. The denial of claim, denial of coverage, prevented you from finding that tumor in your mother's breast. Sorry, but she's already dead. We're sincerely apologize that our denial of your MRI prevented you from spotting that issue in your, lower back, to the point now that it's too late for surgery to fix. I could go on and on. Your answer is to send an apology note. Let me know in the comments what you would do with an apology letter stamped by the United Healthcare CEO, because that is the shareholders' request for an audit and an apology letter. There's a reason I call it the United Corporations of America, because these shareholders are not, some benevolent group of people. It's the same. It's the equivalent of the Amazon shareholders, asking the company to look into these complaints from workers about peeing in bottles and shitting in vans because they don't have time while they're delivering your yoga mat in under 2 hours. Now, that was the first letter that the United Healthcare sent to the Securities Exchange Commission, asking the federal government, which is now the Trump government, to bail it out, block shareholders from doing the bare minimum, block any public display of scrutiny, auditing, looking into their predatory, murderous practices. The second one letter was sent on January 31st. United Healthcare writes, this proposal set by shareholders, shareholders request that the board of directors of United Health Group prepare a report at a reasonable cost and omitting proprietary information on the public health related costs and macroeconomic risk created by the company's practices that limit or delay access to health care. At the board's discretion, shareholders recommend the report evaluate how company practices impact access to health care and patient outcomes, including analysis of how often prior authorization requirements or denials of coverage lead to delay or abandonment of medical treatment and serious adverse effects for patients. A copy of the proponent's complete submissions, including the proposal and the supporting statement, is attached hereto as Exhibit A. The basis that United Health asked the Securities and Exchange Commission to block this rather weak sauce proposal from shareholders. The company hereby respectfully requests that the staff concur in its view that the proposal may be excluded from the 2025 proxy materials because the proposal is impermissibly vague and indefinite, such that it is materially misleading in violation of the proxy rules, yada, 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 and pertains to ordinary business of the company and seeks to impermissibly micromanage the company. Translated, this is a little too vague, and it gives our shareholders too much of a public say to micromanage the way we kill Americans meticulously. We don't like micromanaging of our murderous, predatory, for-profit practices. We need room to operate. Healthcare Hunger Games. Now, to be clear, I don't want to give off the wrong impression that these shareholders are, trying to move mountains here and, do the right thing. These are very, very weak proposals. You don't need an audit. A lot of this information is already public. in terms of UnitedHealthcare's denial rate, particularly how they have meticulously denied people on Medicare Advantage, the way they have deployed AI to deny people at accelerated rates. Their AI had a 90% error rate. Brian Thompson, their slain CEO, was instrumental in deploying AI to deny United Healthcare recipients more. The new CEO that they replaced Brian Thompson with was in charge of their Medicare and Medicare Advantage unit, so he was involved. You don't need an audit. Frankly, if these shareholders actually cared and were actually truly aghast at this murderous for-profit scheme, they'd sell their shares. They'd get out. But they're not going to do that because they're fine making money. God knows how much money they're making off of slowly, or in many cases quickly, killing Americans. But they want, kind of like, Warren Buffett and Bill Gates and Jeff Bezos and all these people, they want to have their cake and eat it too. They want to make money by exploiting people, by killing people in some cases. But they also want the good media coverage of all the, millions and millions of dollars they give to charity, all the millions and millions or billions of dollars they give to other countries to solve deadly diseases. So they could be viewed as philanthropists and get softball adoring interviews by CNN and elsewhere. So the shareholders, they want to, they sleep well at night on their gold plated pillows, but publicly, they want to make it look like they're actually trying to do the right thing and clean up this murderous act. They're not. This is not going to clean up UnitedHealthcare. There is no audit that is needed. There's no report that is needed. Frankly, if we had a Department of Justice that investigated real crimes rather than, Trump deploying his Department of Justice to go after FBI agents that investigated January 6th, and Trump is deploying his DOJ to basically do his revenge tour. If we had a Department of Justice that actually went after corporate criminals, United Healthcare would be numero one. Well, maybe numero 1B next to the Wall Street bankers that tanked our global economy and got off scot-free. And to be fair, it's not just Trump. The Department of Justice under Democrats, Obama, Biden, didn't go after the worst corporate criminals out there. The Wall Street bankers, the fossil fuckers, Big Pharma, the Sackler family that have killed hundreds of thousands of Americans with OxyContin through its fraud. They're off scot-free. They just, have to pay a historic settlement, which is a fart in the wind to them, but they're not going to see any jail time. They're not even going to see a criminal court. So don't be fooled that the shareholders actually care here. But UnitedHealth is literally asking the Trump administration to prevent even the bare minimum of public scrutiny of its murderous practices. And obviously, we are in a very fast-moving, dizzying news cycle. Trump every hour is a new executive action and a new crazy thing. So it's hard to remember. It's hard to keep your mind around the murder of Brian Thompson, the case against Luigi Mangione. But that's why we continue to cover this, because we have an opportunity here. This is bigger than Luigi Mangione, whether you support him, whether you don't. This is about putting a spotlight and keeping a spotlight on death care, hell care, and the meticulous system that is killing Americans, in some cases quickly, and in many cases slowly killing Americans for the price of capitalism. We will continue to cover this. We will continue to cover next week as the case moves forward against Luigi Mangione, and we will continue to cover UnitedHealthcare and other for-profit predatory health insurance companies' fraudulent, murderous practices. Support us, statuscoup.com/join. You could support our independent reporting for as low as $5 a month.